And we are live. Okay. Hello, everybody. My name is Greg Martin. Welcome back to TWIG. TWIG stands for This Week in Global Health. This is your one-stop shop for all the good, the bad, and the ugly in the global health space. This week, we're going to be talking about jobs in the global health space, careers. How do you get a job? How do you find a job? But now that as a topic is unbelievably vast. We can't cover everything in one episode. So this will in fact be the first of many episodes that are like this, right? So we're going to just cover a few things in this episode. We're not going to get through everything. In subsequent episodes, we'll deal with more. Added to that, and you can see him popping onto the screen every now and again, added to that, we've got a special guest from Sierra Leone with us tonight. Because the Ebola virus epidemic is rife right now, we've actually got someone who's in the thick of the epidemic, who's a medical student. They're doing some interesting work as medical students in a campaign called Kick Ebola Out. I think that's what it's called. He can correct me if I'm wrong. And we're going to interview him at the end of the show and just get a little bit of the lowdown about what's happening really at the front line of this battle. All right, before we carry on, I'm going to ask the members of the panel if they will introduce themselves. I'll start with myself. My name's Greg Martin. I'm going to be talking a little bit about the World Trade Organization. Next up, let's see who can. Jessica, talk to us. Who are you, and what are you going to talk about today?
Hey everyone, I am Jessica Taff, and I'm coming to you from the Washington, D.C. metro area today. And today I'm going to be telling you a little bit about jobs at the World Bank. That's actually a place that I work and I consult for them, so I can give you a little bit of an insider look at it. And I also just want to give a shout out to the students at UC Irvine that are watching our show. At least I think that you are. We've been told that this is now part of your curriculum, and you are watching our show, so feel free to tweet us any questions or any comments on the show, feedback. We're just thrilled that you're watching. And also, I know we have reached out to a lot of other universities this week. So if you're watching, again, send us a question, tweet us at the hashtag TWIGHTwig, or just tweet us and let us know where you're watching from, so we can we'll know. So that's great. Thanks, everybody.
That's right. And of course, if you want to email us, you can email us at hello@twigh.org. Okay, hello@twig.org. You can send us an email. Let us know who you are, who's watching, what do you guys think of the show. If you've got suggestions, thoughts, complaints, etc., send them to us. We love the feedback. Okay, enough about that. Moving right along. Look, while I'm doing an advert, let me carry on. Okay, I'm on a roll here. We've got an email address. You can get us at hello@twig.org. We've now got a web page as well. So go to the web page, www.twigh, that stands for This Week in Global Health.org. There's a form you can fill in, and you can subscribe to our newsletter, in which you will get the show notes every week sent to you. So it'll have all the links, etc., that we talk about during the show. And you can actually watch the show live at the web page itself now. So in the past, you used to watch on YouTube or on Google+, and of course you can carry on doing that. But you can also watch the show same time, same place every week at twig.org. Okay, enough. Oh, and there's a podcast, right? So if you're into podcasts, we've got the audio version. We've got the audio version of the show as a podcast, and soon there will be a blog. Okay, enough advertising from me. Moving right along. Katie, talk to us. Who are you? What are you going to talk about today?
Hey everyone, my name is Katie Jackson, and I'm coming to you from Stockholm, Sweden. Today I'm going to highlight Unicef as a place to work and kind of the opportunities that they have there.
Okay, thanks very much, Katie. And then last but not least, we've done Jessica, we've done Katie. Chris Ronson, talk to us.
Hi everyone, I am Chris Ronson. I'm coming to you from San Francisco, California, and I will be talking about potential opportunities at the WHO, as well as a review of the UC San Francisco Global Health Sciences Conference.
Okay, and now I'm going to ask Assad. Assad, could you tell us a little bit about who you are, where you are, and what you're going to talk about today?
Hello everyone, my name is Assad Naveed, and I'm the president of the Sierra Leone Medical Students Association, and I'm talking to you right now from Sierra Leone. And today I will just tell you about the role of medical students in the current Ebola outbreak in Sierra Leone. I will tell you what we are doing here in Sierra Leone.
Okay, thanks very much. Now, I'm just going to give a little bit of context to the rest of the show. And we're going to be talking about jobs in global health. Right now, I've mentioned already, this is a huge topic. We can't cover everything in one show. And and what's on the slide at the moment, I'm not really going to get into any of this today. This is just like for a bit of context. We're going to talk in other episodes about areas that you may be interested in working in, of course. of course, there's also different kinds of roles, different sorts of people with different backgrounds do different things. We're going to talk about that as well. There are multiple different kinds of organizations that you may want to work for, and there's just so many out there. Again, can't cover all of that in this episode today. In today's episode, we're going to talk briefly about UN agencies, which is one of the kinds of organizations that you might want to work for. And we're going to see the first thing you want to do when you're thinking of getting a job in a kind of organization is you need to understand who it is that you're applying to. Right, so we're going to give you a little bit of that background for a handful of UN agencies that do work in the global health space, if that makes sense. And we'll talk a little bit about our experiences in applying for and getting jobs in those agencies. So I've worked at the World Health Organization, for example, before. Jessica is currently doing work for the World Bank, so we're going to get into a little bit of that. I'm going to start things off and talk a little bit about the World Trade Organization. And I'm not going to go into a lot of detail. I'm going to be really brief. But just in case you don't really understand how it is that the World Trade Organization has anything to do with health, let me tell you. So the World Trade Organization, it's relatively new as UN agencies go. Actually, just a little point of a little correction. It's not a UN agency. This is what I discovered today. But in any event, it's very similar to UN agencies. It's governed by member states, etc., etc. Now, the World Trade Organization, relatively new. It started off in 1995. It was a continuation of what existed before, which was the General Agreement on Trade and Tariffs. Okay, I really need to tell myself not to get into all of this technical mumbo-jumbo now. In brief, the World Trade Organization is a forum on which member states can negotiate multilateral trade agreements, and many of these trade agreements have implications for health. The best example, of course, is the TRIPS agreement, the TRIPS agreement, which of course governs patents, right? And that has huge implications for access to medicines. The trade technical barriers to trade is another multilateral trade agreement that has implications for health. Now, how it works is these multilateral trade agreements basically say country A and country B allow for their respective companies within those countries to trade within each other's national borders freely. These countries can put up barriers to that trade, but if they're going to do so, they need to have a good reason. And health is very often cited as an important reason to prevent a certain kind of trade within the national boundaries of a certain country. Okay, so that's enough of the technical mumbo-jumbo around the World Trade Organization for now. The short of it is, a lot of these multilateral trade agreements have implications for health. If you're interested in trade law and international law, that's a very interesting place that you might want to work. And of course, in the context of global health, there's a lot of work to be done there. There's a lot of work that gets done between the World Health Organization and the World Trade Organization. Right, enough from me on the WTO. Let's move on. I'm going to ask Jessica to talk about the World Bank.
Great, thanks, Greg. Okay, so the World Bank. So those of you that don't know much about the World Bank, or you're just familiar with it in terms of international development, or you just hear the idea of a bank in the name and you're like, what does that have to do with health? Well, it actually has a lot to do with health and global health particularly. So the World Bank, it's a financial institution that provides financial and technical assistance to developing countries around the world with the goals of eliminating poverty and helping countries economically develop. Now, they do this by giving low-interest loans, interest-free credits, and grants to developing countries. And these support a lot of different investments across the board, from education to health, public administration, infrastructure. Again, this has a lot to do with international development, but the bank is very focused on health because they have kind of a motto of health equals wealth. The idea that a healthier nation is more able to economically develop. And there's just so many examples of this. Yeah. So they're heavily invested in health for sure.
Point. I'll just jump right in there. You know, until recently there was a little bit of a debate, and I kind of think that we've kind of come down on one side of that debate, because certainly about 10 years ago there was papers being written kind of conflicting ideas. The one camp was saying, look, in terms of health, the best thing you can do is just get all of these countries to be rich, and if you deal with their failing economies, their improved health will just follow naturally. But there was a counter argument that said, look, a lot of these developing countries, people within them are so unwell that until you deal with the health issues, you can't get them out of poverty. In other words, to get out of poverty, you have to first address the health issues. In countries where there's huge malaria epidemics, where HIV is running rife. Now, if you look at West Africa with Ebola virus, these countries, their economies are absolutely in shreds because of disease. And so you can't have an attitude of, well, don't worry about health. We'll just kind of get these countries, their economies up and running, and then, of course, the health will follow. It doesn't work. You have to address health if you're gonna deal with economies. Okay. Again, sorry for my little interjection there, Jessica. Over to you.
Great. That's a great point, Greg. I mean, because I think of in terms of like the neglected tropical diseases that, you know, these are things that keep children out of school. They can't get educated. So it definitely, in the long term, is going to affect economic development. And the other thing is you can't just throw money at nations and expect, oh, you don't know what to do with it. So that's a good tie into what the bank does in terms of providing technical assistance of what is the best way to spend this money or funding specific programs that they know are going to work. So along the same lines, because the bank does a lot of financial assistance and technical assistance to developing countries, they hire all sorts of professionals. They hire IT people, administration, management, and they definitely hire a lot of specialists in all different sectors, from health, finance, agriculture, education, science, technology. Now, if you want to get into the bank, there are a few ways to do this.
Actually, I was going to ask you that, Jessica. How did you get, okay, let's just make that a focused question. Don't talk in general. How did you get your consulting work at the World Bank? Okay, and then we'll talk about the other stuff.
Yeah. So for me, it was definitely through networking.
Okay.
I had been working in a lab that's like I'm a biomedical scientist, and I wanted to transition into global health, and I had been involved in global health, a global health group at the National Institutes of Health, and we'd bring in speakers. And so what I did is I had one of the things I like to tell people about getting into global health, if you want to do it, you need to get out of whatever you're doing at and not like don't leave your job like in the middle of the day unless you can, but you need to be involved. You have, like, so I was going to as many events as I could, and I went to an event and saw the director of the HIV/AIDS program at the World Bank speak, and I loved his talk. It was amazing. I fell in love with their program right there, and I invited him to speak at NIH, and he did, and we kept up, and when I was closing at the end of my fellowship, I asked him for advice and about what to do, and he said maybe you should think about consulting. That's a really good way to get experience and start get your foot wet, your feet wet, I think, right? Or your foot in the door, something like that. Anyway, and so we set up a consultancy with them. I started on a project. I sent my CV. He knew what my specialty was, and I just started working for them, and I've continued working for them, and I work as a science writer for them. So that's how I got it. So networking, making good connections, and impressing the people that you network with, showing that you know what you're talking about, and you also like what they're doing.
Okay, you show an interest. Something that you said that struck me as interesting, and I resonate completely with that. And then you said when you spoke to him, you went and asked him for advice. And I think when people network, that's something to keep in mind. If you bump into a senior person, a director of some organization, you think I'd like to work for them. If you just barge in and you say I'd like a job, they might not mind, but it's unlikely that right there and then they've got a job that they can just give you, right? So, and if you say, have you got a job for me? And the answer is no, that's the end of that conversation. Whereas if you take the approach that Jessica took and you approach someone at that level and you say, look, I just want to get some advice from you, nobody minds giving advice, right? Everybody wants to be the hero, right? So when you ask someone for advice, it's very easy for them to give it to you. They feel good about themselves. They're helping someone from a younger generation. And it starts a dialogue, right? You enter into some kind of communication, some sort of relationship with this person that continues. And if you do that, when the job opportunities pop up, well, now you're on a first name basis with the guy, and you've been or lady, and there's back and forth, and it's much easier to have that conversation about the consulting work or about a short-term contract or whatever it is. Anyway, so I really like that you said you went to him for advice, and that's something I've often done in my career. Okay.
Greg, I could not have put that any better. I think that is a number one way to do things. I always say that people are experts at themselves, so you always ask questions for them. You have to show that you have a little bit of knowledge behind it, like, oh, I really liked your talk on this or your research on this. So you don't seem like you're walking into something without being a little prepared. But they're experts on themselves. Ask them how they got there. Ask them what kind of things brought them to this place and that place. And especially, like you said, don't ask for a job right away. I think wearing the student hat, I know we have some students watching, is one of the best hats you can wear, because people are ready to talk to you, and they have fond memories of being a student. They also think, oh yeah, curious mind, like you just want to ask questions and learn. And then they know you're not going to ask for a job right on the spot because you're studying, and you can't look for a job soon anyways until you're done your studies. So it's a really good hat to wear, and I would use that to the fullest extent. Send emails, go to events like Jessica said, and really reach out during your studies so that when you're done your degree, then you're able to walk more comfortably into a position where you know a few people and you're not just like, oh, I have a degree, someone hire me? Because it doesn't work that way, unfortunately.
I like what you've just said about being prepared, and I'll tell you why. Well, here's a little trick, right? There's someone you want to get in touch with, person, Joe Blogs, right? You do a quick Google search or a search on PubMed, find something that they've written, right, a paper they've written, read that paper, and very often on the papers there'll be the corresponding author's email address, all right, so getting in touch with the person or find them on LinkedIn, or, it's not difficult to find people nowadays, get them on Twitter, I mean, it's possible, right? Send them an interesting question about the paper they wrote. They will love you. That's awesome. I promise you. I mean, it's a sneaky way to start a conversation, but it shows that you're interested. You've taken initiative and you've started a conversation that isn't you in front of them saying, "Can I have a job?"
I don't think it's sneaky at all. I think it shows like drive and commitment. I mean, if you're in a position, and sometimes it happens in global health when you're competing for jobs. If you're in a position like that, like you want to stand out, right? And being driven and being creepy is a thin line, I think, but I think it also can be taken as a lot of enthusiasm. And if you're enthusiastic and intelligent, that is the golden key to everything.
Okay, good advice. Okay,
yeah,
Jessica, anything more about the World Bank? Yeah, carry on.
Yeah. Oh, well, first, on your thing about the enthusiasm, yeah, like, because one of the advice, and we don't need to get to it because we already covered it, but I would say be passionate. I mean, when you show passion about like a certain field or a program, people love that. I mean, because it's flattering. Like if someone, like talking about someone coming and reading one of your papers, no one has ever done that in my papers, but I would be blown away if someone came and asked me some question about my research or something. But
so everyone should go home and now research Jessica's papers.
Okay, or not. Okay, so anyway, a little bit more about the bank. Since we covered most of everything there, but that's how I got to the bank. The other way of doing it, you can go in and get hired directly. Again, a lot of this is about who you know, if the positions are available, and if you make those contacts and they say, but this is, people get into those positions a lot through already knowing people and someone giving them a heads up about that. And a lot of them are more senior level positions. So I wouldn't recommend going that route, but the other route that some other people may be more comfortable with, especially if you're not as comfortable doing the networking, is going through an application route through like a fellowship program or their professional programs. They're like an internship. So those are also definitely other ways that people get into the bank as well.
Okay, thanks very much, Jessica. Right, over to who's next? We've got Chris. Chris is going to talk about the World Health Organization. Okay, Chris, hit us.
I will do that with great enthusiasm if my Wi-Fi works, which I'm hoping it does. So for any of us who are involved in global health, we pretty much need no introduction to the WHO or World Health Organization, but I'm here to give you a brief refresher on the function of this international presence, as well as insight into their goals and purpose. I think getting some background into them is the best way to decide whether or not that's a place that you want to go to seek work. The WHO is the directing and coordinating authority on international health within the United Nations system. They produce health guidelines and standards. They help countries address their own public health issues, as well as supporting and promoting health research. They actually have 6 goals that they define as part of their core functions. And those concepts and goals include providing leadership on matters critical to health and engaging in partnerships where joint action is needed, shaping the research agenda, stimulating the generation, translation, and dissemination of valuable knowledge. They've also got setting norms and standards, articulating ethical and evidence-based policy options, providing technical support, catalyzing change, and then, of course, last and definitely not least, monitoring the health situation and assessing health trends. Now, if you're interested in working somewhere like the WHO, it's good to know what type of people they hire. It pretty much runs the gamut. They are looking for health specialists, medical doctors, scientists, epidemiologists, as well as people with expertise in administration and finance, human resources, logistics, IT, economics, health statistics, really everything, down to emergency preparedness and response. So it's a lot, but there's a place for pretty much everybody, depending on what your interests are. We wanted to provide a little additional assistance in navigating all of that information. And so on the show notes that we send out at the end of each show, we've included a link to 2 things that I found on the WHO website. The first is sort of an informational employment brochure that goes into the role of the WHO, their own internal structure, types of jobs available where they work, and that's called Working for Health. It's an introduction to the WHO, as well as if you want to just keep up to date, because they're always trying to stay current with an ever-changing world and global health climate. We've included a document that goes over their leadership priorities for the next 5 years, and that is called Not Merely the Absence of Disease. And so there's a link for that as well. So definitely check those out. I read all 72 pages. I thought it was riveting, but they have infographics if you'd like a little bit less to read. So
for people like me. Okay, and I worked at the World Health Organization for a couple of years, and I got into the World Health Organization in a very similar to what Jessica was talking about. I started off doing some consulting work for them. It started off with very short pieces of consulting. They turned into more substantive pieces. Eventually, people that I was working with sort of said, look, we'd like to keep you around. Can we give you a short-term contract? And that was a 6-month contract, and that turned into a 2-year contract, et cetera, et cetera. So the route in, the easiest route in that I can tell is through, as Jessica said, networking, doing consulting work. There's always consulting work floating around. It is just a matter of knowing the right people, because there's more consulting work floating around than there are consultants available to do it. And I know that the people out there that are wanting to do consulting work and can't find the work don't believe me, but I really believe that's true. And once you start doing consulting work, you just get flooded with requests, and you have to turn away quite a lot of it. Certainly consulting work is a great way into the World Health Organization, but we can talk more about that a little bit later. Next up, Katie. Katie, can you talk to us about UNICEF?
I definitely can. So UNICEF is obviously one of the organizations that focuses on children. So all those people that want to go, that are a fan of children, will already know a little bit about UNICEF. But what I wanted to highlight was the areas that you could work in, which I didn't previously know about UNICEF. So they have 4 main areas that they hire in, which is program and policy, external relations, emergency, and operations. Program and policy has a subfield of a few health-related disciplines like HIV or WASH, which is water and sanitation hygiene, gender equity. There's also things like human rights, adolescent development, education. So there's different areas within there that you could work. They also do external relations, which is resource mobilization, private funding, and partnerships. There is the emergency category, which actually just has a short description about what might be needed during an emergency. That's on an ad hoc basis. And the last category is operations, so operating UNICEF, meaning finance, administration, human resources, supply and logistics. So things that are quite technical are still needed in these organizations. It doesn't have to be solely a PhD in a certain specific scientific field. You really, if you have some skills and you have a passion for global health, you can work within these organizations. So some examples of jobs advertised in UNICEF. Well, obviously there's consultancy, like we've been talking about. So there is a call right now for developing country fact sheets on pneumonia and diarrhea using the GAPPD framework in Bangkok, Thailand. So if you know what GAPPD means, you can apply for that. They also have temporary positions in media and emergency communications specialist in Geneva. Those are just 2 examples. There's actually quite a few on their website, so check it out. The most exciting thing I found when I was researching UNICEF was that they have a few programs that are meant for people starting out in their career. So there is the Junior Professional Program, and there's currently a call for Japan, a Junior Professional Program. They also have an internship program, and the most exciting, only probably because I like the name, is New and Emerging Talent Initiative. So that initiative asks if you are proficient in English and another official UN language, if you have completed an advanced university degree, like master's or equivalent, if you have 2 to 5 years of professional work experience and you are willing to serve in any UNICEF office worldwide, including hardship duty stations, they mentioned, so you have to be willing to be in the field, then you're able to apply to this initiative. And I think it's really good that they have these programs for entry level. As we discussed, getting into the UN agencies is a bit difficult, so good on UNICEF for having these initiatives. I'm not sure how likely you are to get into them, but at least they're geared in that direction.
Yeah, that's excellent. And we're going to have links to all of that in the show notes. And we also, now on our webpage, www.twig.org, we've got one of the links on the webpage is called Careers Corner. And in that, on that page, we'll include all of the stuff about UNICEF, et cetera, so you can go there. It'll probably be uploaded sometime tomorrow.
And I just wanted to mention one more. We were doing a lot of outreach this week, and we actually had an organization that tweeted us about some of their job opportunities.
Oh, good. Tell us about that.
Yeah, so it's called the George Institute, and you can do, their handle is @George Institute. And they have a few positions right now, and there seems to be mostly research-based, but they have like post-grad position available, something in health nutrition research, clinical trial assistance to join an e-health project, etc. So if you go to the Twig hashtag, you'll scroll down a little bit because it was yesterday, you can find those. But we'll also put all of those links on our website as well, and we think it's really awesome that the George Institute was able to interact with us like that.
Okay, yeah. And if you are an organization out there and you would like us to try and profile some of the jobs that you've got, then get in touch with us at hello@twig.org or via Twitter or via the webpage. There's a form you can submit to send us feedback. Get in touch with us and we will try and help promote or give visibility to job adverts that you've got where you've got positions that you want filled. So, thanks very much. That's exciting. I was glad to hear about that. Okay, anything more about UNICEF?
Greg, sorry. Can I just pipe
jump
in?
Right in there, absolutely.
At our tweets. I just want to say a shout out to Dr. Gregory Bocinos, if I'm saying it correctly, who's watching from school, the North Carolina Gillen School of Global Public Health. So thanks for watching. And we have a few more people. Solzan Bali tweeted again. So just want to say thanks for watching, guys. Okay. Over to Craig.
Okay, brilliant. Yeah, please do tweet us. Tell us where you're watching from, who you are, what are you into, what do you want to see on the show. We definitely want as much feedback as we can get. We want to make this a community, not just a broadcast. And of course, as always, I'm hoping people are tweeting and sending us questions, because at the end of the show, we're going to have some space where we just answer questions and kick things around and have a little bit more of a conversation. Next up, I think at this point, let's go to this Ebola story, because we've done a couple of episodes and we've been talking about Ebola virus a lot. And, this is an ongoing problem. We've got a side with us tonight. Well, it's tonight in my side of the world. He's literally living through the nightmare of the Ebola epidemic, and they're doing some really interesting, exciting things there. He's on the front line. Asad, can you just tell us a little bit about that?
Hello, everyone. So, as I told you earlier, I'm a medical student, and I study in Sierra Leone at the College of Medicine, University of Sierra Leone. And basically, when the Ebola outbreak happened, we were not prepared for this outbreak. And the outbreak has actually affected our daily lifestyle in many ways. We can't shake hands anymore. We just wave when we see our friends. The prices of basic commodities are going up in the country, and people are dying. I know people whose relatives have died due to this. So it's actually devastating. So when the outbreak started, with the medical students, in consultation with the Ministry of Health and Sanitation in Sierra Leone and IFMSA, which constitutes medical students from all over the world, we decided to start a project called Kick Ebola Out. And in this project, what we do is basically we go house to house and shop to shop and tell people about the preventive guidelines of Ebola virus disease. This is because currently there is no treatment for Ebola, so we thought the only way you can save yourself from this disease is by following the preventive guidelines, as prevention is better than cure. So what
Asad, is this the actual medical students? So the medical students from the university are literally going house to house and providing people with information about what to do and preventative measures, etc.
Yeah, these are the actual medical students from various years of some are from final year, some from it's actually a mix, but we're all studying here at the college here. So
okay.
Basically, our college was closed because of the outbreak. We weren't allowed to touch patients, so because of that, the college has closed. And so we started this project in which we sensitize people about the preventive guidelines. So when we go to a shop or a house, after greeting and developing a rapport with the people, we basically tell them about the signs and symptoms of Ebola virus disease so that they become aware of what to expect if someone has developed the signs. After that, we tell them about the preventive guidelines. Some of the preventive guidelines include washing hands regularly, avoiding someone who has developed the signs and symptoms of Ebola virus disease, such as fever, vomiting, diarrhea, which can be bloody at times. Not touching dead bodies of people who have died with Ebola, and not eating bushmeat, as animals are natural reservoir of Ebola.
Right.
So after this, we also tell them about how to prepare chlorine solution to disinfect your hands. So basically, that's great.
Aside, and how is this being received when you go to these shops and you go door to door to people's houses and you're telling them about the Ebola virus? And obviously, a lot of these people will have been affected by the epidemic itself. How is this initiative being received? Are people, are people receiving it well? Is there an element of suspicion, or are people really extremely grateful for the effort that you're going to?
Well, people actually appreciate it because people can't get all the information through radio programs. They can't get like detailed information through radio and other programs. And also, a lot of people here have some some theories about Ebola. Some people think it doesn't. People didn't even believe it existed in the past. It's now that everyone is accepting it because the deaths are really going up.
Just so many
Initially,
people dying, right?
exactly. Initially, people thought the disease never existed, and because it started in an area where the opposition people stay, like in one part of the country, they thought maybe the government has devised something against the opposition party
Right.
so that they will win the next myths such as these ones. So, but now everyone is appreciating. I mean, when they had the opportunity to talk to us and they liked it.
Okay, look, that's really interesting. Now, Asad, don't go away. If you can stay with us longer, please do. What we're going to do, we're going to, if you're watching this on YouTube sometime in the future, then this video is going to end quite soon, right? We're going to cut you off. But if you're watching this live, then don't go away because we're not going anywhere. What we're going to do is we're going to have a couple of questions and answers. I'm hoping that there's questions out there for Asad and what he's doing in terms of the Ebola virus. Of course, please send any questions that you can to me and the rest of the team about anything we've said about careers and jobs and our experience in terms of applying for jobs within the UN system, and any other questions about jobs and careers that you want to. We're going to stay here and just chat a little bit. For those of you that have been watching this on YouTube, thanks for watching. If this is your first time watching this on YouTube, please subscribe to the channel. There's a little red subscribe button on your screen somewhere. You'll get email alerts when there's new episodes. Thanks very much. Don't ever change. Don't do drugs. Always do your best. We'll see you next week, same time, same place, for another episode of This Week in Global Health. Okay, farewell. Right, now.